Hey everyone, I'm Dr. Patrick Krupka. I'm a chiropractor and a nutritionist, and I specialize in functional medicine. Today I'm doing a video on multiple sclerosis and some of the more common, I don't want to call it alternative treatments, but the common approaches that are going to be taken by alternative practitioners. But we're going to be talking in detail about vitamin D and how it impacts multiple sclerosis. Okay? So first of all, what is MS? Multiple sclerosis, or MS, it's generally considered to be, follow me, a chronic, autoimmune, inflammatory, neurodegenerative condition, meaning, okay, chronic goes on for a long time. Autoimmune, your own immune system is attacking certain cells in your body. In this case, the cells that line the nerves that create what's called the myelin sheath. Okay, that's the insulation around your nerves. Inflammatory, meaning the immune reaction creates inflammation. Neurodegenerative, meaning it's degenerating the nerves. Okay, so it's a chronic, autoimmune, inflammatory, neurodegenerative condition. Now, why do people get it? Well, that's a complicated question, but let me talk in some generalities. You can have a genetic predisposition. Now, in functional medicine, we call those things antecedents, things that exist that put you at a greater risk, or conditions that exist. But your genetics are not your destiny, right? That doesn't mean you have to have it. It means you're more likely to under the right circumstances, okay? So genetic predisposition, along with environmental factors, we call those triggers, right? We have antecedents and triggers in functional medicine. So genetic predisposition is your antecedent, along with environmental factors as your triggers. There are over and we're going to talk about some of those, obviously. There are over 300,000 cases of MS in the U.S. right now, and about 10,000 new cases annually. So while it's not an epidemic, most of us know somebody who is affected by MS in one way or another. They either have it themselves or have a family member with it or a coworker with it. It's prevalent enough that it exists in our lives to a fairly great extent. Now, vitamin D. Because vitamin D is very important when it comes to MS, managing it and controlling it and keeping it from happening in the first place. Vitamin D is a vitamin. It acts a lot like a hormone. It's kind of called a pseudo-hormone, but right now it's considered a vitamin by the powers to be. We make it in 3 basic steps. Now, a word of warning, I'm not an artist, bear with me, okay? But we make it in 3 different steps. So we start out with sunshine. That's the sun, okay? So sunshine comes down, and it's UVB rays, the letter B, UVB. Those rays interact with our skin. This is a chunk of skin, right? You can tell that. Sure. So that's a chunk of skin, and it interacts with something called 7-dehydrocholesterol. I can't talk and write at the same time or I misspell things. Okay, so UVB rays interact with 7-dehydrocholesterol in your skin, and that forms the first conversion of vitamin D. Okay, then that goes to your liver. And believe it or not, that's not a boomerang. That does kind of look like the shape of your liver. Your liver's on the right side, just tucked up under the rib cage where it's protected. Okay, liver. So you have another conversion of vitamin D from the first conversion to the second that takes place in the liver. Now, after the liver, it goes to, anyone know what those are? Those are kidneys. I know you knew that because, you know, it's obvious, right? So it goes to the kidneys and gets converted a 3rd time. That conversion produces what I'm going to call active vitamin D. There are a lot of steps here. If you have a liver problem, if you have kidney issues, if your cholesterol is too low, if you don't get enough UVB rays from the sun, none of this is going to happen appropriately, and your vitamin D levels are going to be considerably low. Vitamin D, or low vitamin D, is epidemic right now. I test patients for vitamin D levels all the time, and I bet you maybe 1 out of every 60 or 70 that I test might be close to what I would consider a good value for vitamin D when they walk in the door. Now, we treat them, you know, we give them some vitamin D, we work on some habits of getting in the sun regularly, and we talk about how to do that. But when they come in the door and we initially test them, Rarely do I see what I consider a normal vitamin D. So these are the steps involved in creating vitamin D. It's not simple, but it's critical that it happens. Okay, so what does vitamin D do? I'm talking about it. I'm making a whole video about it. It's got to be important. Generally speaking, it does the following. It facilitates the absorption and utilization of minerals. So it aids in bone formation and maintenance. Now, minerals do other things too, but it's known for bone formation and maintenance. It calms inflammatory responses. It modulates immune reactions. It allows us to react appropriately to one thing and not overreact to another. It is dramatically, I cannot overemphasize this, it is dramatically what we call chemoprotective. Okay, and that means it's anti-cancer. It is a cancer prevention tool. It is a cancer prevention powerhouse, if you ask me, right? And if you go Google or go to PubMed or Medline and you put in vitamin D cancer, you're going to get page after page after page listing articles that tout the importance of vitamin D in suppressing and slowing and eradicating and stopping the risk of certain cancers. Okay, and when I was counting, I saw good, solid information on at least 16 different cancers that we know are dramatically impacted by your vitamin D status. So, dramatically chemoprotective, right? Can't overemphasize that. And it is decidedly anti-autoimmune. I can't say it shuts down autoimmune problems, but it comes really close. Okay, it really helps you get them in remission. It makes you less likely to have exacerbations. In a lot of cases, it makes you less likely to even develop them in the first place, right? Low vitamin D is one of those environmental triggers that we talked about that leads to MS. So, how does vitamin D interact with MS? Okay, this is going to get complicated, so I'm going to write down some of the key things we're talking about so that you can go look those up and become more familiar with them. Okay, so we're going to erase this. Now, how does vitamin D interact with MS? Active vitamin D increases something called interleukin 10 producing cells. We have cells in our body that produce something called IL-10 or interleukin 10. Now, interleukin 10 tends to downregulate several inflammatory messengers in your immune system. So I'm just going to say generally anti-inflammation. Okay, that's what IL-10 does. And vitamin D increases the number of cells you have that produce interleukin 10. Okay, active vitamin D, I'm going to put here increases. Okay, because the next one is it decreases interleukin 6 and interleukin 17. IL-6 and IL-17. There. Okay. All right, so interleukin 6 is pro-inflammatory. It's a cytokine, right? Chemical messenger. It's associated with demyelinating plaques in the brains of MS patients. Now, let's talk about this for a second. Multiple sclerosis. Okay, let's take the name of it, multiple sclerosis. It is an autoimmune disorder that degrades the myelin sheath and ends up producing plaques or sclerosis, right? Sclerotic plaques in the brain or around those nerves. So when you find something like interleukin 6 that we know is associated, it's a pro-inflammatory cytokine, and it is associated with the exact demyelinating plaques in the brains of MS patients that are doing the damage, that's something important to decrease, right? So not only does it increase an anti-inflammatory cytokine, it decreases IL-6, which we know impacts the plaques in the brain, right? That's pretty powerful stuff. Now, interleukin 17 right now is kind of a target for some drug therapies, and it's associated with relapses in MS patients. The higher your interleukin 17 level is, the more likely you are to have relapses of your MS symptoms or flare-ups or progression in your MS cases. So while the drug companies are going after how can we get rid of this IL-17, vitamin D drops it. Vitamin D, it's cheap. And it decreases interleukin 6 and interleukin 17. Now, obviously, you can go get more information on these. That's why I'm writing them down. You can go look them up, okay? Active vitamin D also increases. Now, this is like alphabet soup here, so bear with me. CD4 plus CD25 plus T regulator cells. So it increases CD4 plus CD25 Treg for T regulating cells. or T regulatory cells. Think of your immune system like a seesaw. Okay? So this seesaw can tilt too much one way or the other. Interleukin 10 and several other factors that vitamin D manipulates, okay, hits the center of that seesaw and starts to hold it steady. Keeps it from going out of balance either way. Okay, that's where the T regulatory cells come in. They're regulating that immune system activity. So there are actually tests you can do. They're hard to find because they use them mostly in research. But you can look at this in you. But vitamin D helps increase these regulatory cells that help stabilize the immune system and slow down that autoimmune response. Okay? T cells have the ability also, and here's a little cycle that's neat. T cells have the ability to activate vitamin D just like the kidneys did. Remember we went through that whole big thing and at the end were the kidneys? They did the final activation of vitamin D. Well, your T cells can do that. So if we're increasing certain T cells and they help activate vitamin D, that activated vitamin D goes back and helps increase the T cells. You've now started an upward spiral to get you up out of that hole you're in when you're suffering with symptoms like this. So you can see, and I know that got technical, but you can see on kind of a mechanistic level how important vitamin D is when dealing with multiple sclerosis and other autoimmune problems. This is not specific only to multiple sclerosis. It has a similar set of benefits for many other autoimmune responses. So, does it work, right? This is all great in theory. What happens in practice? A recent study in Toronto led by a doctor named Jodie Burton, J-O-D-I-E, if you want to go look it up, okay? She's an MD. And it was published in the journal Neurology. Okay, so if you go to Google or PubMed and put in, Jodie Burton Neurology Vitamin D, you'll probably come up with this without much trouble. She divided her MS patients into two groups. One got high-dose vitamin D, and the other got no vitamin D. Okay, and they did that for a year. The vitamin D group had 41% fewer new MS episodes than the non-vitamin D group. 41%, that's huge. Right? Prescription medications at best report 28 to 30% decrease. Vitamin D got 41% decrease. That's dramatic. Right? I mean, I don't know whether you should be mad because you haven't heard about it or really excited and be looking it up. Right? That's big stuff. Okay? And the vitamin D group also had an increase in overall physical function, which is not what was generally seen with the medication group. Medication groups had all kinds of side effects and stuff. So while they had fewer flare-ups or recurrence episodes, they didn't necessarily have an overall increase in their physical functional ability, whereas the vitamin D group did. And they benefited from all the other benefits of vitamin D, the anti-cancer benefits and everything else that vitamin D has. And the medications don't have those kinds of added benefits. So I talked about high-dose vitamin D that was used in that study. Let's talk about vitamin D safety. You'll hear a lot about this. Vitamin D is a fat-soluble vitamin, so technically you can build up too much of it in your body, right? Water-soluble vitamins, we all know where they go, right? You just keep flushing them down the toilet. Vitamin D can build up. So all fat-soluble vitamins have the potential to develop toxicity. The study I just mentioned in Toronto included doses of up to 40,000 IU per day for the length of the study with no noted side effects. Okay, now it's important to watch your levels of vitamin D. Don't just run out and start taking huge amounts. Get it tested. We're going to go through this at the end, but don't like stop the video and run to your health food store and buy vitamin D. Watch the rest of this. But vitamin D is a lot safer than you are likely led to believe. Okay, doses currently used tend to be woefully inadequate. Okay, I think the RDA or RDI now they're calling it for vitamin D is between 400 and 800 international units for most people. I routinely put people on anywhere from 5,000 to 15,000 units a day. This study used 40,000 units a day. The dosages can be much higher than what's generally done. Okay, so read the research out there, see what's out there, but a lot of the dosages that get results are up in the higher ranges. Okay, now I'm going to back up for a second and talk about a second implicated trigger with multiple sclerosis. So we're going to get off of vitamin D for just a second. We're going to round out this discussion. We're going to talk about viral implications because it goes along with some of what we just talked about. there's been considerable proof lately that herpetic viral infections can also be a very strong trigger for multiple sclerosis. Okay, now herpetic, any of the herpes family. Okay, and in this genre of viral issues, we're also going to include Epstein-Barr virus, or the mono-related virus. Okay, but the mechanism appears to be this: these viral infections, or these viruses, when they're in our body, produce something called viral interleukin 10. Now, you just heard about interleukin 10, right? Well, this is written with a small v, a lowercase v, and then capital IL-10. So it is viral interleukin 10. Now, it seems like it'd be good to have more interleukin 10, right? But the viral interleukin 10 is different. It fits into our interleukin 10 receptors, and it replaces your own interleukin 10, but it doesn't do what your interleukin 10 does, right? So it's like me going to your new car, and I stick a key in the door lock, and I break it off. It doesn't do anything, but it keeps your key from going in. Now you can't use your car, right? It's a key. You use a key. Sounds good, but that's what it does. So this viral interleukin 10 screws up the whole interleukin 10 cascade, right? Because it fits in the receptor but doesn't do what your interleukin 10 does. And it keeps vitamin D from modulating the IL-6 and IL-17 that we discussed earlier. Okay? So viral interleukin 10 is really detrimental and kind of upsets the apple cart, so to speak, when you're talking about modulating multiple sclerosis or other autoimmune problems. Now, what can be done about viruses, right? We don't have antibiotics for viruses, so to speak. It doesn't work that way. So what do? Many natural practitioners, myself included, have found that something called raindrop therapy using therapeutic grade essential oils can have a dramatic effect on viral activity. Now, I'm not saying that I treat viral infections, right? But for whatever reason, when you do a raindrop therapy, and you can Google it and see what it is, you'll see pros and cons of it, but I'll tell you, I use it in my practice all the time with patients. Phenomenal results if it's done well and if it's done with therapeutic grade essential oils. Okay, I'll talk about that in just a second. But you pair that, right, if you can do something to calm the viral activity, pair that with resolving your vitamin D deficiency, and you have a very powerful two-pronged approach to getting your autoimmune issues, specifically your MS, under control. Okay, it doesn't necessarily eradicate it. Your antecedents are still there. It's already been triggered. The mechanism's active. But you can keep it under control for long periods of time if you go this route. Now, real quickly, therapeutic grade essential oils. Everybody has their preference, right? I'll tell you, in my experience, I've been practicing a long time. I've been using essential oils a long time. Young Living essential oils are the only ones I use. Okay, I trust them. They're therapeutic grade. They're clean. They're unadulterated. They're distilled the right way. And some of the oils in the raindrop therapy, some schools of aromatherapy will say, oh my gosh, you can't put those on people's skin. That's because they tend to be adulterated. You get therapeutic grade essential oils, I'm telling you, it works like a charm. There is nothing wrong with raindrop therapy. It is phenomenally effective. If you're watching this video and you're a patient of mine and you've had raindrop therapy, leave comments down here, right? Back me up on this and tell people about what good it does. But that's what I use for raindrop therapy. I'm going to do a video on raindrop therapy soon, so you'll see that. Okay, watch for it. All right, so what's next for you? Now that you have this information, what do? One more time to the board. We'll give you kind of an action list here. Okay, number one, get tested. Get your vitamin D level tested, know what your numbers are. Understand your results. Understand your test results. Do a little research. Okay? Keep watching my videos. You'll see places where you can get research about it. But get your test results. Understand what they mean. Okay? Correct your level. Get your vitamin D level up where it needs to be. Okay? Consider your viral history. Whoa, that was ugly. There you go. Consider your viral history. Do you have a significant viral history that needs to be dealt with? Okay? Deal with it however you like. I use raindrop therapy and certain nutrients that are, immune stimulatory and stuff in my practice. Other people handle it differently. whatever works for you, but for me, raindrops probably the most powerful thing we do for viral issues. Find good quality raindrop therapy if you need it. Don't skimp. You can actually go to, if you go to my website, drkrupka.com, there's a link on the upper right-hand side to Young Living. You can order products. You can actually buy a raindrop kit that has a DVD and a fold-out instruction sheet, tells you exactly how to do it. If you follow the instructions, you're doing it right. It comes with all the oils. It's ready to go. So buy yourself a raindrop kit, or find a massage therapist or a doctor or practitioner who is schooled and trained in how to do raindrop. Okay, it is not easy, but it works well when it's done properly. If you follow the instructions, you'll do fine. And then find a functional medicine doc to help you out, okay, to help you understand all this and get it under control and understand the viral implications. Find yourself a functional medicine doctor and get this under control. There are likely things that you could be doing to lessen your suffering dramatically if you just knew about them. Now you know about some of them. So go out there, get your information, get your tests done, deal with your viral issues, and get this stuff under control. This is powerful. It is a wonderful management tool for you. So that's my video on multiple sclerosis and vitamin D. Hope you liked it. Leave some comments. Let me know what you think, and I'll see you on the next video. Thanks for watching.